And we've always, I think, thought within the field of EMDR as a technique that you use to treat trauma, as you would with vets. But you're saying it's also a practice model in and of itself.
Yes.
Tell us about this.
Well, EMD very quickly evolved into EMDR, which was a treatment for traumatic memory. And then from there, what we discovered is that every memory that is disturbing to us can be effectively treated with EMDR. Mm-hmm. And so it evolved from a simple desensitization technique to a more comprehensive psychotherapy approach that could treat anything that's based in memory.
Mm-hmm. So let's talk about what some of those anythings could be. What else?
Well, it's clearly anything from a standalone adult onset trauma, which could be anything from a car accident, an illness, an injury, anything that would have a significant impact on any of us, mm-hmm. to more developmental trauma that are based in formative attachment issues. So, for example, if you grew up in a family where someone died or there was a separation, and as a kid you weren't being attended to in the way that you really needed, mm-hmm. and then fast forward, you're now trying to forge relationships in your adult life, and you're having some difficulties in your adult life based on those formative experiences.
Mm-hmm. Okay. And so you're learning EMDR in session with your therapist, and the technique is coming back out into the world with you. You're able to use that when you're out of the office.
Absolutely,
for any of these, yeah. Okay.
Absolutely.
Okay.
In fact, it's not unlike a lot of different therapies. It's similar and yet it's very different. So it has elements of psychodynamic, experiential, cognitive behavioral, and what we do is we take relevant life experiences that our clients come into therapy for help with, mm-hmm. and we connect the dots to the earlier life experiences that inform the client's current difficulties. Mm-hmm. And then we go after those memories and give the brain the opportunity to reprocess mm-hmm. those experiences in present time, mm-hmm. so the client isn't constantly triggered into trauma time.
I see. Okay. Fascinating. So let's talk about what EMDR is actually like. How do you compare it to other models?
Well, what I would say is that EMDR is an experientially based therapy. So it's not for the faint of heart. Right. So, for example, if you had a car accident and now you're having anxiety and panic about getting back into a car again, that is your brain having trouble being in the present orientation, right? So long after the threat has passed, your brain is still orienting mm-hmm. to the threat. Mm-hmm. And so whether it's something like that or an experience of wanting to be close to an intimate and being anxious about getting close because you're afraid they're going to abandon you or they're going to hurt you or something bad is going to happen. In those moments, our brain is going, looks like, feels like, sounds like, must be like. Mm-hmm. Therefore, it's exactly like it was mm-hmm. when I had that accident, when I was growing up in my family. Mm-hmm. And so we work with that collision, that past-present collision, mm-hmm. by identifying what those early experiences are, and then giving the brain the opportunity to reprocess them. So it's very experiential. Mm-hmm. We're not talking about what happened. We're actually giving the client the opportunity to re-experience it within the context of a safe, present environment where they're now likely to be an adult, although it can treat children too.
Okay.
But the present conditions are different than the past.
Okay.
And that's really the cornerstone between reprocessing and re-traumatization. So,
understanding the past and the present difference.
Right. And the therapist's job, one of many, is to keep the client oriented to the dual awareness between the current conditions of safety and comfort versus the past conditions that were difficult and challenging for them. Okay. And that's the difference that gives the brain the opportunity to come to a more adaptive resolution.